Hello, I'm Dr. Dan Soular, family medicine physician and Vice President of Medical Affairs at Grand Itasca Clinic and Hospital in Grand Rapids, here to provide you an update on the COVID-19 vaccine. We are receiving a lot of calls regarding the vaccine, its safety, who should and should not get vaccinated, what happens after we're all vaccinated, and when the vaccine will be available. While we do not currently have a lot of information about when the vaccine will be available to the public, or even the next priority groups, nor the specifics on how it will be distributed, I want to take a couple of minutes to provide some information to you about the vaccine itself. So, when it is your turn to get vaccinated, you will have the information you need to make up your mind on whether or not you would like to get vaccinated. The number one question we've been getting is this vaccine safe with how quickly it's been developed? We understand that people may be nervous about getting a new vaccine, particularly one that was developed so quickly. I want to take some time to discuss the unique aspects of this vaccine and its production. Typical vaccine manufacturing requires identifying a virus, growing that virus, then weakening that virus, and then producing the numerous vials to get out to the public. This takes significantly more time than the process for developing this particular vaccine for COVID-19. The COVID-19 vaccine is the first wide-scale use of an RNA vaccine. Although RNA vaccines and their safety have been studied for many decades. To develop RNA vaccines, a portion of the blueprint for proteins needs to be sequenced in a laboratory. In the case of COVID, this sequencing only took 2 days. Once this sequence is determined, large-scale production was able to start. And because of this pandemic, doses were made for distribution at the same time that studies were being conducted. This was done with the goal of having doses immediately available upon determining the safety and effectiveness of the vaccine. Because COVID infections have been so high, we were able to assess the effectiveness of this vaccine very quickly. Another question we get is, can I get COVID from the vaccine? The simple answer to this question is no. The COVID vaccine produces a part of a protein that is seen with COVID, and that is what our bodies develop immunity to. The entire COVID virus is not in the vaccine. Therefore, you cannot get COVID from the vaccine. Other questions we're hearing are related to those with allergies or those who are immunocompromised. While there have been several reports of reactions to the vaccine, the overwhelming opinion is unless you have had an anaphylactic reaction in the past that has required the use of an EpiPen, you should get the vaccine. The information that we have also says it is safe to get vaccinated if you have a history of mild allergies to foods, antibiotics, or environmental allergens. And for those patients who are immunocompromised, it is actually very important for you to get vaccinated, since you are more likely to contract and experience complications with COVID-19 than those with strong immune systems. Unless you are actively receiving chemotherapy, we recommend you get the vaccine. Another common question I get is related to what happens after the vaccination. When does life go back to normal? Unfortunately, getting the vaccine doesn't mean that life is immediately back to normal. You should continue wearing face masks, practicing excellent hand hygiene, and social distancing until enough vaccine is manufactured and distributed. We learn how long the vaccine will protect us, and our community shows levels of minimal spread. The vaccine trials were not designed to look at the effectiveness of limiting transmission from person to person. But with time, this data should be available, and decisions on public health recommendations will change as that data is known. What are the recommendations if I have already had COVID-19? Because the natural immunity you get from having COVID only lasts a few months, 90 days on average, it is recommended that you get the vaccine if you already have had COVID-19. The immunity you get from the vaccine lasts significantly longer than natural immunity. We do recommend that you wait approximately 90 days from your infection before you get the vaccine, however. Stopping a pandemic requires all of us to do our part. For months, you've helped prevent the spread of COVID-19 by taking steps like wearing a mask, washing your hands, staying at least 6 feet from others, and remaining home if you're sick. Getting vaccinated is another step you can take to help reduce your chance of being exposed to the virus and spreading it to others. Getting vaccinated, along with continuing to follow the CDC's recommendations to protect yourselves and others, will offer the best protection from COVID-19. The more people who get the vaccine, the closer we get to reaching herd immunity. Herd immunity is when enough people are immune to disease. By immunizing as many people as possible, we will reach herd immunity quicker and allow us to start to return to a sense of normalcy. Getting vaccinated is a personal decision. I'm hopeful that with some of the information provided today, you will be able to make the right decision for you and your family. If you have further questions, I urge you to contact your primary care provider to continue this conversation. Thanks for your time and stay healthy.